Hello, my name is Alyssa Chan, and the company I looked into was Fisher & Paykel Healthcare. The healthcare promotion program at Fisher & Paykel was a bit fuzzy, but their overall mentality was to keep employees and employers well and safe. The workplace health promotion plan that I decided to implement addressed the number one risk factor, which was physical stress. Fisher & Paykel was created in 1934 by Sir Wolf Fisher and Maurice Paykel. At the time, they imported refrigerators and washing machines. Moving forward into the late 60s, they invested in a prototype respiratory humidifier to help patients that needed ventilation while in intensive care. Over time, Fisher & Paykel have expanded and improved on products to continue assisting patients, hospitals, and health providers. Currently, Fisher & Paykel Healthcare is a leading designer, manufacturer, and marketer of products and systems for use in respiratory care, acute care, and the treatment of obstructive sleep apnea. At Fisher & Paykel, the four major teams include research and development, international relations, quality and regulations, and direct sales. The research and development team aimed to expand the range of innovative medical devices used to assist clinicians in improving patient care and outcomes. Since most of the products are produced at facilities in New Zealand and Mexico, the international relations team stays in constant communication with other employees in these two countries to ensure that the product range is well supported and that new products and applications for these products are brought to the attention of health professionals and customers. In order to meet a strict set of standards, quality management complies to a range of international standards and ensure that all products are up to par. The direct sales team works directly with distributors in other markets to sell products to hospitals, home care providers, and other manufacturers of medical devices. As mentioned before, the two major products that Fisher & Paykel market and manufacture are heated humidifiers for respiratory and acute care and heated humidifiers for patients suffering from sleep apnea. Sleep apnea is a common sleep disorder in which there are one or more pauses in breathing or shallow breaths while sleeping. These heated humidifiers by Fisher & Paykel act as a simple adjunct to maintain continuous positive airflow. In the United States, there is a high prevalence of obesity and high blood pressure, which can ultimately lead to sleep apnea and poor respiratory conditions. As a result, Fisher & Paykel products can help treat poor respiratory conditions and improve comfort and compliance in patients with sleep apnea via their innovative humidifiers. With the information that was given to me on the website, the best way I was able to get in contact with a representative of Fisher & Paykel was through a phone interview. I spoke to Katie from Human Resources and introduced myself by first stating my name and then informing her that I was a student at the University of California, Irvine. I then proceeded to ask her a few questions about the demographics of her company as well as questions regarding workplace health promotion techniques. Although she was unable to answer a few questions, I was able to learn more about the company through her. The first question I asked was, how many employees are currently employed at Fisher & Paykel Healthcare? She said that worldwide, there are a little over 3,000 employees. However, at the facility in Irvine, California, there are between 70 and 80 employees. Although she could not give me any more demographic information at the time of the interview, I was able to talk to her more about workplace health promotion and potential risk factors within this company. The second question I asked was what workplace health promotion programs are implemented currently. She mentioned that there was not a specific workplace health promotion program currently being enforced. However, as a corporation and as a business, their primary focus was keeping employees and employers safe, well, and happy. The next question I asked was what the top two health issues demonstrated by employees were. She claimed that physical stress and a sedentary work environment were the top two health issues. The last question I asked regarded food that they offered at the company. I was interested in seeing if there was a correlation between poor eating habits which could have resulted in the physical stress. She stated that many of the employees went out to eat for lunch due to the convenience. Even though there is not a strong workplace health promotion program implemented, Fisher & Paykel believe that corporate responsibility, along with sustainability, are fundamental to success, as well as maintaining good ties with shareholders, patients, and the community. Overall, both the employee and the company can benefit from a well-implemented workplace health promotion program. Keeping the employees safe and happy could result in long-term benefits, including less employee sick days and improved mental health, resulting in increased output of work. Analyzing what the human resource manager told me, it seems that the physical stress and sedentary lifestyle at work leads to an overall health problem in the workplace. Compared to the United States as a whole, obesity has become a major health concern, with 1 in every 3 adults being obese. In addition, the CDC has identified inadequate amount of physical activity and poor nutrition as risk factors directly contributing to chronic diseases and high stress levels. Ultimately, the goal for this workplace, as well as the general population, will be to improve nutrition, increase physical activity, and lower stress to create a healthier lifestyle in and out of the workplace. Using the public health programs for the corporate world, I learned that asking free response questions and multiple choice questions were the best when asking about health. I chose to stick with free response questions since I conducted my interview with Human Resources over the phone. The 2 additional questions I tried to ask Human Resources were, have you ever given any thought on how to decrease absenteeism in the workplace, and what could be an alternative solution to employees' poor eating habits? Although I was unable to get these 2 questions answered during my interview, I thought moving forward and creating awareness about the risk factors resulting in physical stress in the workplace would be a good starting place for implementing a workplace health promotion program. In addition, by determining the underlying causes for physical stress in the workplace, the program itself would become more beneficial for the employees. Educating the employees and employers on developing a stress-free work environment will be more beneficial in the long run than creating incentives. After getting approval from executive management, the next step would be to have the employees complete an online survey about their own health concerns. Responses will be received quickly and anonymously, in the sense that other employees won't know how they responded. Since Human Resources already mentioned the #1 health issue at this company to be physical stress, educating employees and employers on how stress can affect the body long-term would then allow for the discussion on how to diminish workplace stress. Once the final logistics are sorted with management, the funds could be put to educating employees. Using education resources from online sites is a quick and reliable way to gather information on long-term workplace stress. Using this method of educating employees would provide a safe and stress-free environment. A second opinion is to provide bi-monthly counseling with trained human resource staff on workplace stress. By training the human resource staff instead of inviting someone from the outside, costs can be kept down and employees are more likely to feel safe and welcomed. In addition, poor eating can lead to physical stress in the workplace. Providing employees with healthier food and snack options and using price manipulation would allow them to choose the healthier option. This is not a quick and easy fix in reducing physical stress in the workplace. However, by implementing these techniques over a longer period of time, there will be more opportunities for employees to take advantage of and take part in the workplace health promotion programs. In order to monitor the effect of the program I have implemented, creating surveys that employers and employees can fill out will yield the most accurate response. Among the employees, I expect there to be better moods, less absenteeism, and overall better work output. Decreasing stress levels bring great benefits to the physical body, but also the work output done by the employees. In addition, allowing human resources to monitor the program from within the company can allow stronger work relationships to form, and employees can feel as if where they work is a safe and caring environment. In an article I read, financially healthy organizations are likely to be those that are successful in maintaining and retaining a workforce characterized by good physical, psychological, and mental health. Based on the size of the company and their interaction with patients and healthcare providers, I do believe that they can create a stronger workplace health promotion program by including some of the tips I have suggested. If they continue with the program that they have now, they may start to see poor performance and more absences. However, if they implement my suggestions, they could reduce employee stress and decrease the number of absences due to work-related problems. As mentioned before, sedentary workplace was the second health issue that the human resources manager mentioned. Even though putting a fitness complex in the business seems a bit unrealistic for the size of the company, Implementing programs that promote walking, even if it's just to get lunch, and mini exercises to do while at a desk could greatly improve mood, posture, and the amount of stress while at the workplace. Overall, this company seems to pride itself on good relations between employee and employer and between employee and the patients and providers they work with. In time, I do believe Fisher & Paykel can create a strong workplace health promotion program to keep their employers and employees safe, happy, and well.